Hi, I'm Dr. Umair Shah, Executive Director for Harris County Public Health, and I want to welcome you to this training for our Casper exercise. This important exercise would not be possible without the time, dedication of volunteers just like you, so thank you for helping us. One of our health department's most important roles is helping our community be prepared for the unexpected and assisting residents during and after a disaster or public health emergency. We will be going door to door to survey people about how prepared they are. This raises public awareness for the need to be prepared and provides us with critical information to respond effectively when a disaster or emergency strikes. You will be receiving training today on how to conduct the Casper survey safely and successfully, so please feel free to ask questions along the way. Again, I want to thank you for joining our department in this important community exercise. We couldn't do it without you. Thank you.
When disaster strikes your neighborhood, how will emergency responders know what you and your neighbors need in order to recover? To help with this problem, the Centers for Disease Control and Prevention, CDC, developed the Community Assessment for Public Health Emergency Response, or Casper. Casper is a survey method for quickly assessing the health status and basic needs of the communities during normal conditions and/or after a disaster. A Casper done after a disaster allows public health and emergency managers to prioritize their responses and to make informed decisions regarding the distribution of resources. You are here to receive a just-in-time training to participate in Harris County's Casper. Caspers can be conducted after emergencies or during non-emergency situations. During non-emergency situations, Caspers are useful in determining the community's overall preparedness level and will assist in promoting community resilience efforts prior to any emergency. The goals of a Casper are to rapidly obtain information about the needs of a community, to produce population-based estimates for decision makers, and to assess new or changing needs during the recovery period. Prior to any Casper, a Casper planning team is created. The Casper planning team includes Harris County, regional, and state partners. This team determines the Casper objectives and agrees upon the assessment areas. As you participate with the Casper, the objectives will be shared with you and other participants. In addition, the forms and survey are also produced by Health Department staff. Copies of the forms and surveys will be provided to you. You will be given time to review and practice administering and using these forms during this training and again before the actual Casper. The epidemiology members of the Casper planning team will determine and divide maps for Casper clusters or sets of homes. Dividing up the areas makes it easier to survey. After clusters are finalized, maps are generated for each cluster. Maps are printed to show street and aerial views to allow each survey team both views of the area being surveyed. Each team will be given assigned areas and provided with their specific maps. In pre-disaster Caspers, when time allows, the planning team also physically survey the areas to note any items that could be surprises for the field teams on the day of the Casper, such as areas that have gated entrances or areas that are not accessible. Our Office of Communications, Education, and Engagement produces and publishes press releases and media messages through various communication outlets such as radio, TV, community newspapers, and social media. In addition, we inform community partners about Casper events before they occur. This public messaging and communication will help ensure the community is aware of your presence and the reason you are out in their area asking survey questions. While working on the day of the Casper, it is important to know that an incident command structure is established and you will fall within that structure and considered a strike team. Each team will report to a group leader that will be stationed at the incident command post, also referred to as the Emergency Operations Center. Each team will consist of 2 to 4 people. These team members can be health department staff, community emergency response volunteers, medical reserve corps volunteers, student volunteers, or other members from the community. In some cases, we may also partner with an amateur radio emergency services member who may also accompany the team. It is imperative that each person remains safe at all times. To ensure safety, each team will consist of no less than 2 members. Each group leader will provide each strike team with their contact information, whether it is a phone number, radio channel, or other form of communication. Each strike team leader will communicate with their group leader on a consistent basis to inform them of their status and location. When you and your team arrive at a residence, whether during an emergency or non-emergency, be aware of your surroundings. Look out for floodwaters, downed power lines, domestic or wild animals, situation-specific hazards, and other threats to your personal safety. If you have any doubts about the safety of a house or area, mark it on your tracking form and move on to the next house. Safety is our #1 priority. If it is safe, 2 members of the team will approach the house, and if there is a 3rd member, he or she should remain near the vehicle but in sight of the other team members. After ringing the doorbell or knocking at the door, the team members should take 2 to 3 steps back to allow for space. When the person at the residence answers the door, make sure to clearly identify yourself as a member of the health department survey team. Do not, under any circumstance, enter the residence. You may be provided with car magnets to help identify you while in the field. Please place these on your car prior to reaching the houses. A member of the County Sheriff's Office will be present at the incident command post and can be contacted if needed. Stray animals are a possibility after a disaster, since many times gates or homes are destroyed. During a non-emergency, stray animals may be encountered. When you approach a neighborhood cluster, look for any stray animals in the area. If you get to a house and there is an animal loose and you feel unsafe, mark it on your tracking form and move on to the next house. If you do not see any stray animals, exit your vehicle and make sure to make lots of noise before walking away from your vehicle. For example, dogs will mostly come out to see what the noise is, in which case you will be able to get back in your car if needed. If there is a dog chained in front of the house and you feel uncertain or have doubts about safety, mark the house as inaccessible and move on to the next resident. Safety is our first priority. The next section will cover documents that need to be completed when conducting a Casper. Before you go out into the field for this Casper event, you will be provided with several tools: cluster maps, the survey, a household tracking form, a verbal consent script, a letter from the health department executive director or local health authority, and information for the public and possibly giveaways to leave behind. You will receive printed maps for your clusters, with each cluster designated by a number. If possible, you will be provided with both an aerial map and a street map. Pay close attention to the outlines designated on the maps. These specify boundaries for the sampled clusters. You must only survey housing units within these lines. Do not attempt to survey housing units outside of the sampled clusters. Each cluster will have an N designated. This is calculated as the number of housing units in a given cluster divided by 7. The goal is to complete 7 surveys within each cluster. For example, if there are 28 houses in a cluster, 28 divided by 7 equals 4. The N designated would be 4. Therefore, you would go to every 4th house. The first house would be counted a 0. Then you would count the next houses, 1, 2, 3, 4. The 4th house is the one you would select to survey. Upon entering the cluster, you will be given a random number that will assist you in finding your first house. Your first housing unit will be number 0. Beginning with the nearest housing unit to that starting point, count each house until the nth house is reached. This is the first house you should attempt to survey. Continue to survey every nth housing unit until 7 surveys are completed. Some clusters are quite large and have been divided into subclusters. The process of selecting housing units within each subcluster is the same as the process for the full cluster, except that N is always equal to 3 within each subcluster. A housing unit tracking form will be provided to you to document the outcome at each sampled housing unit. Each sampled housing unit must be evaluated and documented, with each housing unit representing a single column on the tracking form, regardless of the number of attempts made. The tracking form is broken into 4 sections. Type of dwelling, the type of structure that best describes where the resident lives. Access, whether the housing unit can be physically reached, and if not, why not? No answer. If the housing unit is accessible, what happens when attempts are made to contact the resident? And interview. If attempts to contact the resident were successful, was an interview completed? And if not, why? We will now go through several examples of how to use the tracking form to document certain situations you will likely encounter. If the resident declines to participate in the survey, document the type of dwelling, specify the housing unit was accessible and the number of attempts as appropriate, and mark as no interview, resident declined. If the housing unit is vacant, document the type of dwelling, specify that the housing unit was accessible but vacant, and that no survey attempts were made. In post-disaster Casper events, sample housing units may no longer be there because they were destroyed. In this situation, document that there was no housing structure and that no survey attempts were made. If you attempt to survey a given housing unit and no one is present at that time, mark it on your notepad. You will need to revisit the house one more time before marking no answer on the tracking form. If there is still no one present the second time, document the type of dwelling, specify that the housing unit was accessible and the number of attempts as appropriate, and mark as no answer, door was not answered. When you successfully complete a survey, document the type of dwelling, specify that the housing unit was accessible and the number of attempts as appropriate, and mark as interview was completed. In the row for survey number, enter the next sequential number, starting with 1, indicating the number of completed surveys. The first completed survey should be 1, the second completed survey should be 2, and so on until the 7 surveys are completed. You will be provided with copies of the survey that will be used during the Casper event. In order to make the analysis and interpretation of the collected information as reliable as possible, it is important for everyone to use the same words with each household and to minimize any variation in the wording and delivery of the survey. Please use the following guidelines. Before starting the survey, you must obtain verbal consent. Consent can only be obtained from adults age 18 years and older, so the interview must not be completed by minors. The Casper survey and the verbal consent statement must be kept confidential. Do not make any notations on the survey or tracking forms that could in any way be used to identify the individual or housing unit address.
11 to 17.
We've got one of those as well.
18.
For open-ended questions, document responses as close to verbatim as possible. Do not attempt to interpret what the resident says. Do not lead the interviewee to a specific answer. Ask the questions and allow the answer as they see fit. The survey may have an area where it asks the household member to list a few items. There are examples provided on your survey, but do not read out answers to residents. Record or mark the ones the household member lists. If they need you to repeat a question, please do so. If the household member refuses to answer a specific question, mark refused and move on to the next question. A refused answer is still an answer, and the survey is deemed complete if all are answered. The survey may be provided in multiple languages depending on the area being surveyed. Your interview will be considered complete when the household member has answered each question or otherwise indicated that they do not wish to continue. The Casper planning team may also give you a number of questions that, when answered, will allow the survey to be considered complete. For example, the planning team may decide that if the household member answers 17 of the 21 questions, the survey is complete and can be counted towards the goal of 7 completed surveys for the cluster. This number will be different for each Casper event. While you are out in the field, there are several things you need to keep in mind. First and foremost, safety and well-being of the field teams is priority. If you feel at all unsafe with a given situation, do not attempt an interview and leave the area. Mark the housing unit as inaccessible, safety concerns, and continue to the next sampled housing unit. All sampled housing units must be documented on the tracking form, regardless of outcome. If the property or housing unit has a no trespassing sign, or purple fence posts, or other purple markings painted on trees, mark the housing unit as inaccessible, no trespassing, and continue to the next sampled housing unit. No soliciting should not be interpreted as no trespassing. These housing units may be surveyed. If the nth housing unit is under construction, do not document this housing unit on the tracking form and attempt the next available housing unit. In your packet, you will also receive a signed letter from the Health Department Director in multiple languages indicating the purpose of the Casper. This can be used to give household members in the case they have questions regarding the purpose of the Casper, or given to an apartment manager to show that you are there on official Health Department business. When you have completed the survey, provide the household member with the giveaway materials provided. These are intended to provide the household with more information about how to be prepared, along with more information about the Health Department services. Each team will be expected to communicate with their group supervisors on a consistent basis to indicate status of survey completion and location. You will be asked to either use your cell phone or provided with the radio. Amateur Radio Emergency Services, or ARES, personnel may also be with you, communicating with the Incident Command Post. To use an 800 MHz radio, turn it on. Make sure before you leave out to the field that you have the right radio channel set on your radio. To talk, press this button, wait for a beep, continue to hold down the button during the entire portion of your message. When finished, release the button in order to allow for the person on the other end to reply. If you run out of materials, please contact your group supervisor. They will either instruct you to return to the Incident Command Post, or someone will take them to you in the field. When the Casper is done, return to the Incident Command Post. Provide the completed tracking forms and surveys into the appropriate bins or containers. Place the unused copies in another container. place your maps and notepads in the area designated. Check in with your group supervisor so that they are aware of your return and communicate any issues or questions to them at that time. At the designated time, or once all teams have arrived back to the incident command post, a hot wash will be conducted. A hot wash is a discussion that is conducted at the conclusion of the Casper activity to identify strengths and weaknesses of the response to a given event. A member of the incident management team will facilitate the hot wash. Throughout the Casper, please feel free to write down notes of things that are going well or things that can be improved for the next Casper event and bring them with you to the hot wash. Thank you so much for agreeing to assist us with this community assessment for public health emergencies and response, or Casper. You are providing a valuable service to our community.